Ako si Amy at ako ay HIV positive.
Tama lang.
Uy, Jane, please mo naman. Dahil pang patient sa labas.
Ito na. Wait lang.
Ako si Roxanne at ako ay HIV positive.
Uy, siya yung classmate mo? Si Roxanne? Oo, siya na yun. Bakit?
Uy, Roxanne! Ba't lagi ka mag-isa?
Ay, hindi. Yung puno.
Gusto mo sumama sa amin? May tutry lang. Tara.
Uy, nandiyan na pala sila.
Saan?
Oy, start na. Oy, tara na. Nauna ka na yata.
Wait lang!
Hindi pa.
Si Roxanne nga pala.
Sino yan? Ay,
O, tara.
bagong kakosa pala ito eh. Ay, upo ka. Ito, upuan na. Wala na upuan. Upo ka.
Opo ka.
Ano yung bag mo? Tapon mo na to. Ano? Parang umpisa na natin to. Ano, gusto na ba? Masarap to! Premium quality! Basta organic, good!
O, para sa'yo. Tara na. Nakatikim ka na ba niyan?
Puta! Sarap pala na ito eh! Oh pare, katol ka!
Katol, mukha. Katol.
Karam nga ulit ito! Sarap pa! Hoy, ano ba?
Thanks.
Ah! Okay, ikaw! Mga newbie dito ah! Oh, ano yan? Inumin mo na yan! Ito, sunod mo to, katol ha! Masarap to, sabay sa alak!
Ako si Juliana, isa akong ina at HIV positive ako.
Mom, ano ba si tita?
Di naman lagi yun eh.
Doon ako sa friends ko.
Sige, text ka na ka.
Diyan lang eh.
Mag-text ka naman.
Sayang load.
Tumawag ka.
Ayaw.
Bye, ingat ka. Oras ng tagal.
Oh, Mami, sorry, late ako. Nasakta talaga ng puso ko.
Bakit? Meron ka ba?
Oo.
Wait lang. Parang tagal ko na atang hindi nagkakaroon.
Baka naman nakashoot na si Pao.
Nakakano ka ba?
Bakit naman mag-miss ka na? Magigininom na ulit ako.
Hindi yan.
Ako ka na nga, parang nagkasitas ka na.
Di ba may ano naman? Tara, hindi tayo.
Hindi, meron ako dito sa pag.
Meron ka?
Oo. Ready na.
Oh, na. Sige.
Tara.
Mom, di ka pa ba tapos?
Misa mo naman.
Buntis? Paano buntis?
Buntis. Pregnant.
Reggie.
Oh. Bakit?
Paano mo nalaman?
Nag-ano ko, nag-test.
PT.
Hmm.
Ilang ginamit mo?
Isa.
Ay, hindi pa,
Bakit? Bakit ka ba ganyan?
hindi pa sigurado yan.
Ayaw mo ba?
Naalin. Siyempre. Okay. Pero sigurado ka ba? Nabuntis ka nga.
Ayaw mo ata.
Hindi naman sa ayaw ko, pero hindi. Kailangan mo magpalab.
Ito nga, ito.
Ano ba to?
Yung dalawa. Nakita mo dalawa?
Isa lang to. Dapat pag magaganit, umaga ka ba umihi?
Oo.
Bakit?
Isa ko sa'yo!
Bakit?
Ayaw mo ba?
Hindi naman sa... Masama ang timing.
Bakit?
Dumating na resulta ko kanina galing sa Glasgow.
Na?
Positive ako for HIV.
Bakit ngayon pa? Paano yung baby natin?
I am Leia, and I am HIV positive.
Woo! Wow, Lex!
Naman!
Ang inang, tatangan nyo naka-headset kasi tanggalin nyo para marinig kayo.
Painumin niyo muna, Brad. Painumin niyo muna. Libre! Dali niyo na yan doon. Akin yan. Akin na yan. Ako mauuna. Walang magulo.
Hoy, ako
Ako
sunod.
una. Ako una. Ako una.
Uy, sapatos ang bako!
Woo! Sige pa, pre! Sige pa, pre! Sige pa, pre! Selfie! Selfie! Woo! Tama na yan! Sige pa, pre! Huwag mo pipigilan, pre!
Sarap mo!
Sige pa, pre! Sige pa, pre!
Ako po si Piolo at HIV positive po ako.
Here's your visa.
Saan ba to?
Oh no! ISIS, after you.
Sige, akin na ayaw mo. Mas kailangan ko pa naman ito. Kakabreak ko lang ng boyfriend ko.
Ako talaga? Uy! May ano dito ah.
Saan? Dito?
Hindi, ito.
Saan yun?
Yan. Wala na.
Bala pa.
Ay, sige. Teka lang, may panyo ako.
Yan, sige. Pagkaso.
Lang.
Meron pa ata sa ano, sa gilid. Sa bato ko meron din dito.
Meron na rin dito.
Oh, ayan. Hindi, balik. Meron pa ulit.
Ay, sorry.
After seeing the 5 stories of HIV, let us now talk about what HIV truly means.
HIV stands for Human Immunodeficiency Virus. It is a virus that attacks our immune system and makes it weak, such as our body becomes prone to other infections. HIV is different from AIDS, which stands for Acquired Immunodeficiency Syndrome. When a person is infected with HIV, the first few stages of infection may not be noticeable, but he is capable of transmitting the infection to others. At the late stage of infection, the immune system is already very weak and the body is infected with opportunistic infections. The person now manifests different signs and symptoms. This is called the AIDS stage, and this is the last stage of HIV infections, right before possible death.
There are 4 ways to transmit HIV.
The following fluid may contain human immunodeficiency virus. Let's start with blood and blood products. How about some breast milk? Or some vaginal fluid? I know what you want. Seminal fluid.
There are 4 conditions to transmit HIV.
Just remember that these conditions is easy. E-S-S-E. E is for exit. The fluid must be able to exit the body of the infected person. S is for sufficiency. There should be enough amount of the virus to be transferred in order to infect. S is for survival. The virus must be able to survive during transmission. And E is for entry. The fluid must directly enter the bloodstream of the other person.
Just remember the A, B, C, D, and E's of preventing HIV. A. Abstinence. Ayoko muna.
Sex?
B. Be faithful. Basta ako at ikaw lang. Saan dito?
Sex?
C. Condom. D. Don't do drugs. E. Education.
Ito yung cortical agglutination. Ginagawa siya kapag nag-positive sa rapid ACT. So yung, kasi may dilution siya. So gagamit ako ng 4 wells, first, second, third, fourth. Dito, gumagamit ako ng 75 UL na sample diluent. Yung sa second, third, at fourth well, maglalagay ako ng 25 UL ng sample diluent. So, didilute ko siya. Dahil dun sa first well, kukuha ko ng 25, tapos salin-salin hanggang dun sa 4. So, yung makuha ko na last sa 412, dinidiscard ko na. Tsaka ako maglalagay ng reagent na tig to 25 UL din, na equivalent siya sa 1 drop. Yung unsensitized, since unsensitized siya, dapat ang lagi niyang result, negative. Yung negative, yung ganun kaliit. Yung circle niya buo, ay hindi pala buo, kasi maliit lang siya. Tapos pag malalaman mo kung may reaction sa 1 and 2, katulad nito, parehas reactive. Malaki, yung ano niya yung buong circle. Yung ano mo na, nakapag-drop ka na ng mga reagents mo, dapat ganyan lang siya for 2 hours. Kasi pag nagalaw siya, minsan ko na kahit hindi negative, pwede siyang maging ganyan. Nakakalain mo, plus 1. Ganun. Pwede siyang maging ganyan. Yun lang. For 2 hours. After 2 hours, pwede mo na siyang basahin. Yun mo na i-grade.
HIV could also cause a multitude of immunological abnormalities. The most common is lymphadenopathy, which indicates a primary stage in AIDS infection. Others are proliferation of anti-CD3 monoclonal antibodies, decrease in CD4 positive T helper activity, and in the normal functional activity of B cell, like severely decreased activation of B cell in vivo, and weak antibody response of T cells to neoantigens. Along with these are serum IgG level elevation, severely decreased function of T cells and monocytes. Lastly, a significant immunological abnormality which indicates that a person is already at the intermediate stage or ARC, known as AIDS-related complex of HIV, is the inverse CD4-CD8 ratio, which is 0.5:1. There are myriad of serologic markers for AIDS or HIV. Among the following are the several serologic markers for AIDS or HIV. The first marker is the P24 antigen. The P24 antigen is the first serologic marker to appear after 6 to 8 weeks of infection. However, during the 6 to 8 weeks, HIV-infected people demonstrate a window period of seronegativity. Seronegativity means that the amount of antigen produced by HIV decreases. So this means that P24 antigen decreases as anti-P24 antibody rises, causing many false negative results in many serological tests. So the best test during window period is called PCR because it's not a serologic test but more on a DNA test. Secondly, the anti-GP41 is the first antibody to be detected by serological tests. This marker persists throughout the entire life of the infected patient, and the test that is used to analyze this and diagnose this is Western blot assay. Then from 6 to 8 weeks up to months of infection with AIDS, anti-P24 antibody begins to rise, which can be detected by a common screening test known as ELISA. Finally, after years of infection, P24 antigen again begins to rise, which can be used again as a marker for HIV, but this time there is no window period, so it can be detected by serological tests.
January 1984 was when the first HIV/AIDS case in the Philippines was reported. Since 1984, there have been 12,421 HIV cases in the country, with AIDS cases already numbering 1,270.
HIV is still on the rise in the country. In fact, the Philippine HIV and AIDS registry for 2013 reveals a 79% increase compared to 2012. There are 431 new cases reported as of June 2013.
All new HIV cases were acquired through sexual contact with 387 cases, still coming from the males having sex with males, accounting for 88%. While 43 cases are from needle sharing among drug users and 1 case from mother-to-child transmission.
96% of the cases reported were still asymptomatic, and as of June 2013, the bulk of new HIV cases came from NCR, Region 7, 4A, 3, and 11.
HIV is transmitted through the following body fluids: blood, semen, vaginal or cervical fluids, and breast milk. Unprotected sex is the predominant mode of transmission.
HIV is not transmitted through kissing, casual contact, handshake, or sharing living quarters. This does not also include mosquitoes, bedbugs, or eating or drinking with an infected person.
There is no vaccine and no cure for HIV. Antiretroviral medications can only slow down the replication of the virus.
They are around us, but we don't live.
HIV is not spread through touch, tears, sweat, or saliva. You cannot catch HIV by breathing the same air as someone who is HIV positive, touching a toilet seat or doorknob handle after an HIV positive person, drinking from a water fountain, hugging, kissing, or shaking hands with someone who is HIV positive, sharing utensils with an HIV positive person, and using exercise equipment at the gym.
Having HIV doesn't mean your life is over. Don't give up. Early years of the disease epidemic, the death rate from AIDS was extremely high, but today, antiretroviral drugs allow HIV-positive people and even those with AIDS to live much longer, normal, and productive lives. Get yourself tested. Don't wait for symptoms to show up. When you have been exposed to HIV by having unprotected sex, needle prick, sharing of needles, etc., please take the HIV test.
Just remember the A, B, C, D, and E for HIV prevention.
A. Abstinence.
B. Be faithful.
C.
Condom.
D. Don't share. E. Education and information.
So on June 27, the National HIV Testing Day,
Get involved. Take the test and take control.
Spread the knowledge, not the virus.